You're listening to ABC Radio Melbourne.
Interesting how a word can conjure up all sorts of different things. This is much more pragmatic and straightforward, this part of the program at 29 minutes past 10. Dr. Justin Hunt is an Australian-trained orthopaedic and spinal surgeon with his main surgical practice in Melbourne. And today he joins you to talk about replacing your hips because, you know, it gets to that time in life where you could be younger and they're wonky. You might have osteoarthritis or you might have a ripped labrum. Or you could be older, they could be failing you. What are the options to get a new one? Good morning to you, Justin.
Thanks very much, Libbi.
Did you think you'd be on a Hippy show?
As I was driving in, when I heard the line about the Hippy, I thought that's a nice way of introducing this subject.
It is.
Of course, it's much broader than just hip replacements, but the population is ageing and more people are having hip trouble.
So what is the age? Do you know a median age for hip replacements? Is there an ideal age or is there an age when they start becoming a problem?
It's usually 60s and 70s, and it does depend on whether or not you have primary osteoarthritis, where the cartilage inside the joint wears, or whether there's an anatomical problem where the ball isn't round or the socket is too shallow in the hip replacement. In the hip.
But you've got to a certain part of life with the ball not being quite the right shape or the socket not being quite right. Why does it suddenly become a problem?
It's whether it becomes symptomatic. So you can have a problem with wear in a joint, but if it's not causing any symptoms, and most people don't really know early on whether there's a problem, it might take many, many years to develop some changes, and then all of a sudden, maybe only with a short history of a few months, I have this groin pain which I didn't have before. It's a muscle strain. It's, I go to the physio, but then it turns into something else. Often it's quite insidious the way it comes. And then there may be a slow progression or a rapid one, but sometimes it just sort of creeps up on you.
So how do you, I've had conversations about this, about a number of things this week. If someone says to you, oh, it's just physio, go to the physio, and it persists or gets worse, oh, do Pilates, strengthen your core, it persists and gets worse. How do you set yourself on the track of either eliminating or identifying that it may be a hip problem? Because you can often be sent way down a track and have all sorts of medical expenses associated with some sort of treatment, which an MRI up the front would tell you that the problem is to do with the joint.
Yeah, well, hip problems themselves, the actual joint itself is an incredibly robust thing. We take many, many steps every year, and most of the time hips don't wear out. Only a small percentage of the population overall, out of 20 million people, only 40,000 hip replacements were done last year. Right. That's increasing every year because the population is ageing. But we think of the hip as very robust compared to the knee. But the potential for a diagnosis of a groin strain or some other problem is frequently there, especially in the younger population. And because often hip pain itself doesn't really manifest as, well, what is hip pain? For some people it's groin pain, for some people it's pain over the side of the hip, lower back, thigh pain, knee pain, sometimes pain all the way down the leg like sciatic pain might be. So it can be very difficult to pin it down. A small percentage of people that I would see have not had the diagnosis made. You know, they've been maybe seen several people, maybe medical, maybe not, but it's still kind of elusive. Often is back pain, and then you do an examination and find there's a pair of stiff hips that are driving the back pain. So sometimes it is quite difficult, but a period of physical therapies is reasonable because often there are muscle problems and things often settle down and things are okay. So if a period of or burst of physio doesn't change things, then maybe seeing a medical doctor and getting a referral for an X-ray. It's a reasonably straightforward investigation and can, once the person knows what's wrong with them, it often is quite empowering rather than not knowing.
Well, exactly. And free to ask another couple of questions and do another couple of things instead of just having someone say to you, just keep coming.
Yeah. So I think...
you know your own body.
Changing tack and I think many people with chronic conditions such as back pain really benefit from physical therapies, benefit from exercise programs, but hip-related pain symptoms usually don't. So if the pain persists and things are getting worse, other areas are being involved, like there is radiation down the leg, or there's back pain, and there's a limp, there's difficulty with sleeping. They're all things that become very intrusive into one's everyday activities and really...
Yes, because you can't lie.
Life. So then you get a bit shitty.
Yeah, you can. That's a medical term for... Deb from Marupna has said, they tried to tell my husband he was too young for a hip replacement. He had his replaced when he was 40. He also had a fusion on L4 and L5. Interestingly enough, I wanted to know how long would the hip replacements last?
Younger people have an underlying cause. Either they've had trauma to their hip, which has resulted in the hip wearing out because the lining is no longer nice and smooth. Others will have a bump or a shallow socket, as I've said before, that prevents the hip from working properly. The issue with a young person is really the survival of their hip really depends on several factors, but mostly their activity level. And younger people are doing more, often have family, kids, running around, active job. And so we know that if we take a cohort of young people and compare them to a cohort of people who are, middle-aged or elderly, they'll be doing more, and there's more potential for wear of a prosthesis that then might result in failure of the prosthesis, then resulting in a revision procedure. So the reason to put it off is to prevent the possibility of a further operation down the track.
Can you do 2 hip replacements on the one hip, or it's not preferable?
The best outcomes are with the first operation, generally speaking. The risk of a further revision being required, the more procedures you have, is higher, and the outcome of a second operation in terms of the benefit for the person, how good they feel that the hip is while they're improving, it's not as good as the first time round, generally speaking, and the complexity of the surgery goes up.
Right.
From a primary operation, which is where you do the first hip replacement, to a revision where you're changing parts. But the available implants that we have for revision surgery have improved a lot over the last 10, 15 years.
It's a very fast-changing industry, isn't it? I've got a text which I'll share with you. It's from Bob. He says, Justin, you fixed the hip 2 years ago, home 2 days later. Now haven't been better for 40 years. Good on you. Cheers. This is the interesting thing about hip replacements. They want you to get on the bike immediately. It's not like you have to lie in bed for weeks on end and let the damn thing heal.
Yeah, the ways that hip replacement surgery has changed over the time when they were developed around 50 years ago is that there's been an evolution of the prosthetic design, and they're more durable than they were. They last longer, generally speaking. And also the techniques for doing the operation to put them in are slowing people down less surgical stress. So this is where the real focus is on implant survival, because people are getting in a way younger because they're doing more into their as they get older, and they have the expectation they should be able to do that. And then in addition to that, there's the other aspect, which is where people have the requirement that they want to have less pain and really probably have more expectations of a good result than what we've had before. And in line with that, the hip replacement itself, the design and the function and the longevity has increased. So the community's expectations are increasing all the time. The doctors who are performing the procedures want to be able to offer the patient a fast recovery with a prosthetic design that's going to be good and has a low risk of reoperation. Because
there was the whole controversy with the articular surface replacement hip, the ASR, that was designed by Dupuy and marketed by Johnson & Johnson. So what it said was it would give greater mobility, help patients get back on their feet quicker, but it actually, as a metal hip, it sort of disintegrated and it poisoned patients to a certain extent. Have you had any exposure to that?
Yes, I have. The benefit of that prosthesis was that because it's got a very big ball, it's very stable early and allows people to get going quickly. And the concept of metal on metal is very hard and takes a long time to wear. And there was another prosthetic design, another hip replacement called the Birmingham resurfacing, which still exists today, which a copy was made. And they sort of, I guess, changed it a little bit and marketed it as similar. And what happened was, because of the small changes in design, it resulted in that being less durable, and people having problems with wear of the metal on metal bearings and causing trouble. And that's an example of where a new prosthetic is put on the market
without being tested properly.
Although there's something on the market that's very similar, which has been around for a long time, small changes in something that works can result in it not being as durable and as effective. That's the problem with that type of implant.
If you would like to ask Dr. Justin Hunt a question, we've got a little bit of time where you can do so. 1300 222 774 is the number. 1300 222 774 about your hips, quite frankly. That's why we're here. 1300 222 774. Is the level of regulation for joint replacements, hip replacements in particular, has it improved since that whole debacle, one would have to call it?
I'm not involved.
Because doctors were concerned about that, weren't they?
Oh, yeah, I think so. I think what's happened is
I'm not trying to blame you, I'm just asking.
There were sort of, I guess, this is the wheels of development are turning all the time.
Right.
And often things that have been successful in the past for a period and then weren't are revisited. And the concept of metal on metal bearings did solve some of the problems associated with wear of metal on plastic, where the plastic's soft, metal's hard, and you get wear. So, and the other problem...
Put your headphones on, you got some calls.
Oh, okay.
Keep going. The other problem?
The other problem is with the issue with the bearings is that ceramic on ceramic surfaces could be brittle and crack or squeak.
Okay.
So there's problems with every type of bearing, but the metal on metal designs themselves were popular for a while, gone out of vogue, and because of this problem with the resurfacing, they probably will not come in vogue again because it's seen as a bad option for bearings.
Libby, we have a friend in late 40s, very overweight and having hip replacements. Cheers, Anonymous. Don't know what that means. Why don't we just take some calls? Adrian in Arthur's Seat, good morning.
Good morning. I'd like to ask your guest his views on stem cells in terms of replacing the cartilage surfaces of hips.
Stem cells.
Thank you for the question. It's a question I often get asked, and often it's from people who are younger, people who are looking for an alternative and trying to get pain relief. And the concept is very appealing because the idea of stem cells moving into a joint, repopulating the lining of the joint, and then diminishing pain or perhaps even reversing the process of osteoarthritis is very appealing. The main problem with it is that the joint is quite a hostile environment, and while we think of stem cells maybe regenerating and the lining and producing if you like, almost like a new joint, or at least helping fix up the joint that's damaged, there's not a lot of evidence to support the use of stem cell injections in joints at the present time. There's some clinical trials that have been published, but they're probably of limited value because of the way that the patients have been recruited, and they're always associated with another procedure, so it's really quite complicated.
Thank you for your...
Sorry, they're associated with another procedure like a partial hip replacement?
Or, no, usually like an arthroscopy of the hip or something like that, where the person has a procedure to clean up the hip joint, and then the stem cells may be given also.
Right.
But at this stage, there's very little evidence, and the joint is a very hostile environment. There's lots of pressure on the surfaces, which has caused the wear in the first place. And I think we're quite a long way from having a good solution in terms of stem cells. But there's an enormous amount of interest and a lot of development and research going into that area at the present time.
Thank you for your call. Hello, Peter.
Hello, Libby. I had my hips replaced when I was 40. I'm now 57. And have no trouble with them. I've been able to do everything, ride a bike, play golf, climb a ladder, do whatever I need.
Mm.
My question is, ongoing now after 17 years, I'm having no problems, but should I have a maintenance check, or what should I do?
Thanks for that question. I'm glad things are going well. 17 years later, that's common for joint replacements to last that long. We know that 90% of joint replacements will last 15 years, maybe not in your age group, but in the age group for a sort of average age, 60 to 7-year-olds, then what you could do is see your local doctor and have an X-ray taken. If you're not getting symptoms, then the hip is probably functioning well. If hips become painful or they make mechanical clunking or some other sensation occurs, then that might be a sign that there's extra wear. And there are guidelines that say that, yes, maybe you should have a checkup every 5 years. It sort of depends a little bit on what bearings were used inside the hip as well. If you have ceramic on ceramic, they tend to wear very little. Metal on plastic articulations wear more. So my advice to you would be that there's no harm in really getting an X-ray, having a check, and if you had concerns of any nature, to have a referral to a surgeon.
Thank you for your call, Peter. I have a question on the text message. My husband's ceramic hip squeaks. What should he do?
Ceramic bearing squeaking have you
come across this before?
I have had a few patients who I've seen who've had that, not in anybody I perform this procedure for. Usually it's been not a big problem. Like it's been something they've noticed where they're lifting their leg up to do their shoelaces. That sort of thing, where it hasn't really been a major impediment to their everyday activity. And it really depends how big the problem is, but is the problem bad enough to require a revision of the hip replacement, changing the bearing surfaces, the parts in the hip that are wearing? I guess that's the fundamental question. But there's not much you can do. Live with it, or if it's bad enough, consider having something done. But that would require a detailed discussion with an orthopaedic surgeon about the pros and cons.
Joan from Mount Martha, hello.
Hello.
Your turn.
Yes. Can I just speak now?
Yes.
Yes, well, 7 years ago, or more than 7 years ago, I had a neck of femur and it was screwed and plated. Then I had to have that taken out and have a hip replacement. And last year in September, I fell and doing exercises and I broke or fractured my pelvis. And I have 2 fractures in the pelvis. Now, there's talk now of me having to have a new hip replacement.
Do I have to, is the question.
Sometimes fractures can loosen the implants, and with the history that you've had of 2 fractures, it may be that you've got some underlying weakness in your bone structure.
But they wouldn't recommend that unless it was necessary. Surgeons aren't out there working for business, are they? Are they?
No, I don't think so. I think in this particular situation, it would really depend if there were symptoms associated with the current fractures and whether the implant socket, that is, of the hip replacement looked loose.
And if you felt like getting a second opinion, Carmel, you should.
There's no harm in
You have to get second opinions.
For another opinion.
I think we've probably got time for one more call, although I've got a full board of calls. I'm tossing up what to do as we speak. Michael from Altona, good morning.
Good morning, Lee.
Welcome.
Thank you. I've just got a different question regarding C4, C5 and C6. I had a fusion about 5 years ago, and I just wonder if it's a permanent thing, or as I'm getting older, will it affect my neck, or it's something that I've got to live with? Because every so often, unawares, I make a sudden movement and I thought, oh, I shouldn't have done that, and I can feel a little bit of pain in there. Now, is that something I should see the doctor about it, or it's just a normal thing?
Yeah, I think if you've had just very quickly, if you've had a fusion, it means that there's more stress placed on the adjacent segments of the spine above and below. It means you're a little bit more prone to getting more wear there. So having a check is a good idea.
Thank you for your call, Michael. It is 12 minutes to 11 o'clock. We are out of here at 11 o'clock. I'm going to take some more calls in just a moment because Justin is here and you seem to want to talk about your hips. So I'm happy to do so. 1300 222 774, 1300 222 774. And you can all just rejoice in this while Justin takes a deep breath and we've reset ourselves here at 774 ABC Melbourne and ABC Local Radio Victoria. 774 ABC Melbourne, the Beatles, a little bit of hippie shake this morning. There's so many people wanting to talk to you, Dr. Justin Hunt, who is giving us best advice as he can, but when we say advice, it's not really advice. It's general in nature. It's information that you can take with you to your medical practitioner, because we can't diagnose on the radio, but I can say that we've certainly hit a socket, haven't we, Justin? So it's good to know that. Let's take another call, shall we? I think we were possibly up to line 6, and Robin in Main Ridge. Hey, Robin. Good morning to you, Robin. That doesn't want to work. Hi, Robin. Gotcha.
Yep. Hello.
You're on.
Yep. I'd like to ask Dr. Hunt the difference between the anterior and posterior surgery for hips, and what is his preference personally.
Thanks for the question, Robin.
But maybe the advantages and disadvantages, if you could tell us.
Sure. The anterior and posterior refer to different ways of getting to the hip. There are really 3 main ways. You can go through the front, the back, or the side of the hip. Anterior refers to the front and posterior refers to the back. They're both procedures that are done reasonably commonly at the present time. Posterior approach is excellent for access to the hip and is traditionally probably the dominant way of doing hip replacement surgery. That and the approach from the side. The newer approach is the anterior approach in hip replacement surgery from the front. I usually do the anterior approach because of the potential for early recovery. That's what it's all about, getting people back, less surgical stress and improving their outcomes early.
Do you get them on the exercise bike the next day?
If they can walk and get up and they feel fine after the anaesthetic and everything else, they can usually walk the next day, maybe exercise bike in 3 or 4 weeks. But
Right.
you've got to sort of walk before you can
Bike.
Yeah.
Okay, got it. Thanks, Robin, for calling.
Thank you.
Maria, hello. Good morning, Maria. It's not Maria at all. It is Jenny. Morning, Jenny. Jenny's gone. Hello, Ben.
Hi. I'd like to speak to the doctor, please. I've
He-
just had hip surgery on Monday,
Yeah.
and I've got a little bit of swelling in the top of the leg. The bottom of the leg's fine, but is that a common thing?
Yeah,
And how
yes.
long will it go? How long will it take to go away?
You get swelling with any hip surgery, whether it be arthroscopic or another procedure or hip replacement, mainly because there's the healing response. And with healing, there's inflammation. With inflammation, there's swelling because there's excess blood and fluid going to the area. It's really common to have that. And it depends on the individual, but it can last up to 2 to 4 weeks. And then it will usually settle pretty quickly after that with hip surgery. Keep the leg up when you're resting. And
So if I'm lying flat, then I have to have some pillows.
yeah, and you can,
Above my
yeah,
heart.
it doesn't need to be that high, but just so it's not, your leg's not dependent. And if you're worried at all about the wound, get a wound check from your local doctor
Yeah,
or
no,
go back and
my
see the
wound-
surgeon.
My wound's okay.
No, you're just a bit worried, but it's okay. It sounds
Yeah.
like it's doing all right. But if
I'm
you are
doing
worried,
well.
you must consult your doctor.
Yeah, absolutely.
All right.
I've got the phone number.
Beautiful. Thank
Thanks
you.
for your help. Bye.
Bye-bye. Well, that was timely, wasn't it? Good morning to you, Mark in Shepparton.
Good morning. I've just got a train going past, so just excuse any noise. I'm pulled over on the side of the road. Now, I knew you were hipster, Libbi, so for extra time. I'm 54, being told I would be needing 2 hip replacements. I'm diabetic, which is under control, insulin dependent, and just how long should get off because it'll be healthy. Only lasts so long.
Now, we've got not a very good line, so let's just ask the question and we'll see if we can answer for you.
Yeah, how long should I hold off before getting a hip
Wait.
replacement? Hip replacements, yes.
Yeah.
It's really until you feel that you can't cope with the symptoms any longer, and whether that's the primary symptom relating to the hip or whether it's another problem where you can't walk anymore, you can't sleep at night, those sort of things. But at your age, better to try and prolong if you can. So there is no definite line in the sand. This is when you have to have the operation. It's a personal preference. It's a journey that everybody's on when they know they've got the problem and they know what the solution is. But it really has to be the right time for you, psychologically and physically. That's what I'd say. So can't give you the definitive answer, but prolonging would be good because then we know at the other end if you live into your 80s, there's a good chance that that you may need to have a further operation should the hip not survive that long.
You just don't want to have an operation in your 80s, do you? I mean, plenty of people do. Plenty of people do. Let's take Linda. Thanks, Linda. Linda, your turn to talk.
Oh, hi. I just wanted to know if there's a solution to avascular necrosis by having a hip replacement.
Hey, thanks for the question. That's a less common reason for having a hip replacement, but it is a well-known reason for having a hip replacement. Avascular necrosis has many different causes, and sometimes when the hip wears out as a result of the head collapsing and the head not being uniform in its shape, then a hip replacement may be required. There are other procedures that can be done before a hip replacement sometimes, but if the arthritis is set in, then a hip replacement is the option, and it's a good option for the management of that problem, again, if the symptoms are really becoming intrusive and difficult to manage.
Well, it's a bit it's painful, and it goes. I've had it in the other hip at some stage, and then latest MRI, a couple of years ago now, didn't show any evidence of it. So, can it heal itself? Which seems odd to me.
It can. Yes, I've seen several people who've had healing, but some people don't have healing, and some people have ongoing collapse of the head and arthritis, and it's really very, very quick to become a major problem. But others have had seemingly resolution for a period, and then maybe the symptoms have got worse again. But it really, if it's only one insult to the femoral head of avascular necrosis, sometimes the head can survive.
Thank you very much for your call, and thank you to everyone who's called in today. We've still got a full board of calls, and we didn't even get a chance to talk about what's hip in food. But, it doesn't matter, because I can see that you wanted to ask these questions of Dr. Justin Hunt, and thank you very much, Justin, for coming in and answering.
Pleasure, Libby. Thank you.
Hippy questions. Oh, I did want to ask just before you left, number of text messages about building strength in the hip. Is it cycling and swimming? Are they the best?
Non-weight-bearing activity is good because the impact load in a hip that has got wear can irritate it. I find that anecdotally most people do well with hydrotherapy. If hip flexion, bringing the hip up towards the chest, is causing pain, then if you are going to get on a bicycle and attempt to do that, then you should have the seat up higher. That might reduce the amount of irritation in the hip, but they're both really good things that could be done as long as they're not irritating.
Isn't that interesting? And then to avoid osteoporosis, you need weight-bearing exercise.
Exactly. So it's walking is good, but other activities such as running with a problem with the hip are not a good idea.
Justin, thank you very much for joining us. And thank you to everyone. We've still got a full board of calls. We've run out of time. I'm so sorry. But I am grateful to all of you who have contributed to the program today. That's a long stretch, 6 till 11, but I do love the last hour. It makes it so worthwhile when I can see that it answers a question that you might have in your life.